Hi, Dr. David W. Kim. This is part 2 of my video blog on structural rhinoplasty. So far we've talked about some of the reasons that rhinoplasty is difficult and why there are so many complications and problems with non-structural rhinoplasty. The purpose of this lecture is to discuss techniques in structural rhinoplasty that are designed to avoid these type of problems. So we spoke about how much human variability there is in the anatomy of the nose. That was one of the reasons why rhinoplasty is difficult. The other problem is the operation tries to make changes in the shape of the nose by altering the form and shape of bone and cartilage. Now the problem is bone is brittle and rigid, cartilage is elastic, so these structures are very difficult to sculpt into whatever shape you want. They're not clay with infinite ability to mold into the shape that you want. And more importantly, these structures are there for a reason. So if you try to exceed the limitations of change of the bone and cartilage, you might create problems in the function of what these structures provide. Such as to keep a nose breathing. The other problem is that there's skin and soft tissue that covers the sculpture that's created by the bone and cartilage. We've talked in a previous video blog about skin considerations. Thick skin tends to hide improvements, therefore a different approach to rhinoplasty is necessary, and reduction rhinoplasty may only be shrouded by the thick skin envelope, whereas thin skin, although it can contract more and there's more flexibility in reducing the size of the nose, for example, the thin skin is less forgiving, so any imperfections are more likely to be revealed through that thin skin envelope. This is a photograph taken from Christo, who is a famous artist, who wrapped the Reichstag, which is a famous building in Germany. This thin sheer covering doesn't leave much to the imagination to understand what it looks like underneath. Thin skin and rhinoplasty is the same thing. Thin skin is like this large drape over this building. Any structural contours are going to transmit through the skin, but if there are any problems or irregularities, you're also going to see it through the skin. Now, the opposite is thick skin. So I'm using Madonna not because of her nose, but just because she's a famous lady who is very fit. She obviously has a great body. When Madonna's wearing a big parka like this, you don't really see the contours of her body. This is because this very thick covering hides what's underneath. So let's say Madonna had a change in her body shape, either from weight loss or whatever, what have you, plastic surgery. I'm not saying that she did. But let's say that she has some change in her body, then she puts on a big parka. You're not going to see those changes. Here in this picture in Vanity Fair, you see her wearing a very sheer, thin outfit that shows all the contours. Thick skin hides things, thin skin reveals things. They can both pose problems in rhinoplasty if you're not thoughtful about how to tailor your operation to match the skin considerations of the nose. The skin also will undergo this relentless contracture after surgery. When we're lifting up the skin from the undersurface of the bone and cartilage, the skin has to undergo healing, and it heals by trying to contract. These, as well as other forces of inspiration, which cause the nose to pinch, gravity, muscle activity, all these things can cause the skin to change. Now, Michael Jackson, again, is the poster child of this because he didn't have a strong enough nose underneath all of that skin to resist that contracture. Structural rhinoplasty tries to maintain the structural integrity of the nose to resist that postoperative scar contracture. So what are the keys to success? Well, like in any operation, the most important thing is diagnosis, understanding what the anatomy is, understanding what anatomical abnormalities are creating the visible change, and then having the experience to know what to do about it. Based on the diagnosis, we can choose the right techniques, and then we have to be very meticulous and very careful when we execute. The focus of the remainder of this lecture are going to be about some of these techniques. And the key to the selection of these techniques is structural preservation. That absolutely is the most important thing in structural rhinoplasty. The remaining parts of this video blog are going to be more details about some of these techniques, highlighting some of the principles of structural rhinoplasty.